It's 6:47 in the morning. You're sitting at the edge of your bed. Your chest feels a little tight. You haven't even stood up yet, and already your heart is beating faster than it should. You reach for the blood pressure cuff on your nightstand. 148/92. Again, you take a breath. You tell yourself it's stress. You tell yourself it's the coffee you haven't had yet. You tell yourself you'll talk to your doctor about adjusting the medication at your next appointment. But what if I told you the reason your numbers won't come down has almost nothing to do with salt or weight or the pills already in your medicine cabinet? What if the real problem is something you've been doing wrong, roughly 20,000 times a day? Since the moment you were born, most people over 60 believe high blood pressure is a plumbing problem. Narrowed arteries, thickened walls, a heart that's just getting older. And that is part of the story, but it is not the whole story, not even close. The part nobody explains to you in the 12 minutes your doctor has is that your blood pressure is not primarily controlled by your heart or your arteries. It is controlled moment by a nerve, a single nerve. And that nerve is influenced more by how you breathe than by any medication ever invented. My name is Dr. James Carter. I'm a cardiothoracic surgeon with over 2 decades in the operating room. I've held failing hearts in my hands. I've watched stiff, pressure-damaged arteries split apart under a scalpel. And the thing that stays with me after all these years is this. Most of the people who ended up on my table did not have to be there. Their blood pressure had been quietly destroying them for years, and nobody had shown them the one lever they could pull from their own living room that might have changed everything. That's what this video is about. Here is where standard advice falls short. Your doctor tells you to walk more, eat less salt, take your medication, lose a few pounds, manage your stress. All of that is correct. None of it is wrong. But for most adults over 60, it is also not enough. And I want to explain why in plain language, because once you understand the mechanism, the solution becomes obvious. Think of your nervous system like a car with 2 pedals. One pedal is the gas, the other is the brake. The gas pedal is what kicks in during an emergency. It speeds your heart up. It tightens your blood vessels. It raises your blood pressure. It was designed for moments of real danger, a predator, a threat, a crisis. The brake pedal is what calms you down. It slows your heart. It relaxes your blood vessels. It lowers your blood pressure. It was designed for everything else: eating, sleeping, healing, living. For most people over 60, the gas pedal is stuck, not pressed to the floor, but stuck halfway down. All day, every day. Not from real emergencies, from decades of shallow breathing, poor sleep, chronic worry, and stress that never truly lets go. Your body is idling at high speed, and your blood pressure reflects it. And here is what nobody has told you. The single fastest way to unstick that pedal is not a pill. It is not a walk. It is not a lower sodium diet. It is your next breath. Let me tell you about Arthur. Arthur was 68 years old, a retired accountant from just outside Atlanta. He came to my office for a pre-operative consult before a valve replacement, and his blood pressure was a mess, 152/94. Even on 2 medications, he was exhausted. His cardiologist was exhausted. His wife was exhausted. Everyone had been telling him the same things for 15 years. Lose weight, cut the salt, walk more, manage your stress. He had done all of it. He'd lost 12 pounds. He'd cut his salt in half. He'd taken up morning walks at the park near his house. His numbers had barely moved. When he sat across from me, I asked him a question no one had ever asked him in 15 years of cardiology appointments. "Arthur, how do you breathe?" He looked at me like I'd lost my mind. I had him count his breaths for 1 minute while we talked. 18 breaths, every one of them shallow, every one through his mouth, every one from his upper chest. I told him what I'm about to tell you, that his nervous system had been stuck on the gas pedal for probably 40 years, and that no pill was going to unstick it. Only his breath could do that. I showed him one simple technique: 5 seconds in through the nose, 5 seconds out, 10 minutes in the morning, 10 minutes before bed. That was it. 6 weeks later, he came back, 128/82, down 24 points on the top number. His cardiologist reduced one of his medications. Arthur looked at me and said, "Doctor, I've been on blood pressure pills since I was 53. Not one person ever asked me how I breathed. Nobody does. That is what we're fixing today. Now, before I walk you through the 3 techniques, I want you to do something with me right now. This is a test. It takes 10 seconds, and the answer will tell you a great deal about the state of your nervous system. Place one hand on your upper chest. Place the other hand on your belly, just below your ribs. Take a normal breath, the way you would breathe if you weren't thinking about it. Don't change anything. Which hand moved? If your chest hand moved more than your belly hand, your nervous system is stuck on the gas pedal. You are breathing the way the body breathes during stress, all day, every day, even when you think you're relaxed. If your belly hand moved more, you're ahead of most adults your age, but we still have work to do. Either way, what you're about to learn will change the conversation between your breath and your blood pressure for the rest of your life. I'm going to walk you through 3 specific breathing techniques. I'm ranking them from fastest acting to most powerful for long-term change. That order matters because I want you to have a rapid reset tool, a daily practice, and a foundation for permanent cardiovascular retraining. Number 3. The physiological sigh. This one looks like nothing. It takes less than a minute, and yet, in measured studies, it drops heart rate and blood pressure faster than any other breathing pattern ever tested. Here's why it works before I tell you how to do it. Throughout the day, tiny air sacs deep in your lungs, called alveoli, partially collapse from shallow breathing. When they collapse, carbon dioxide accumulates in your bloodstream, which keeps your nervous system in gas pedal mode. A double inhale reopens those sacs all at once. A long, slow exhale releases the built-up carbon dioxide and directly stimulates your vagus nerve, which is the main line to the brake pedal. Here's how to do it. Take a deep breath in through your nose. Fill your lungs about 80% of the way. Then, without exhaling, take a second, shorter sip of air through your nose on top of the first. Now, slowly and gently exhale through your mouth. Let it out completely. 3 to 4 cycles. That's it. I use this myself, before stressful conversations, before I check my own blood pressure at home, because it gives me a more accurate reading of my true baseline. In the parking lot before a difficult meeting, it is your rapid reset button, and you can press it as often as you need to. Number 2. Box breathing. This is the technique used by Navy SEALs to stay calm under combat pressure. It happens to also be one of the best tools ever discovered for retraining an aging cardiovascular system. Here's the mechanism. First, when you breathe in a pattern with equal holds on either side, your heart rate and your breath rate synchronize in a specific way that cardiologists call respiratory sinus arrhythmia. This synchronization directly improves something called heart rate variability. And heart rate variability is one of the single most important predictors of how long you are going to live. Higher variability means a flexible, resilient cardiovascular system. Lower variability predicts cardiac events. Here is how to do it. Breathe in through your nose for 4 seconds. Hold for 4 seconds. Breathe out through your mouth for 4 seconds. Hold for 4 seconds. That is 1 box. 4 to 6 cycles. Twice a day. Morning and evening. About 90 seconds each session. You can do it in a chair, in your bed, or at your kitchen table. Over a few weeks, it quietly rewires your nervous system to default to calm instead of stress. Number 1. Resonance breathing. This is the technique I believe every adult over 60 should be doing every single day. And what most people completely miss about it is not how to do it. It is why it actually works. Most people think slow breathing lowers blood pressure because it calms you down. That's true, but it is only the surface of the mechanism. The real reason is something called your baroreflex. Your baroreflex is your body's own built-in blood pressure thermostat. Pressure sensors inside your arteries constantly measure your blood pressure and send signals to your brain to keep it in range. In a healthy 30-year-old, this system works beautifully, but after decades of stress, poor breathing, and aging, the baroreflex becomes sluggish. It stops responding. Your blood pressure drifts upward and nothing inside you is pushing back. At exactly 6 breaths per minute, a remarkable thing happens. Your heart rate, your blood pressure rhythm, and your breathing rhythm all lock into perfect synchronization. And that synchronization retrains your baroreflex, wakes it up, sharpens it, restores the sensitivity you had at 25. This is not a temporary effect. It is a permanent recalibration of the system that regulates your blood pressure every second of every day, whether you are actively breathing this way or not. Here's how to do it. Breathe in through your nose for 5 seconds. Breathe out through your nose or mouth for 5 seconds. 1 complete breath takes 10 seconds. That means you are breathing at exactly 6 breaths per minute, 5 to 10 minutes, once or twice a day. That is all. A study published in the American Journal of Hypertension found that adults over 60 who practiced resonance breathing for 10 minutes a day over 8 weeks lowered their systolic blood pressure by an average of 11 points and their diastolic by 6. No medication changes, no diet changes, just breathing. 11 points. That is what a well-titrated blood pressure medication produces. Now, before I wrap up, I want to tell you the 3 biggest mistakes I watch people make with these techniques, because I've had patients come back to my office after 3 weeks and tell me it didn't work. Every single time when I walk them through what they were actually doing, I find one of these 3 mistakes. Mistake 1. Expecting overnight miracles. One session gives you a temporary drop in blood pressure. That is real. But the lasting change, the kind that shows up at your next doctor's visit, takes 4 to 8 weeks of daily practice. Your nervous system did not become dysregulated in 3 weeks. It will not rebalance in 3 weeks either. Be patient. Mistake 2. Stopping medication without medical supervision. Please hear me on this. Never stop or reduce a prescribed blood pressure medication on your own. If your breathing practice brings your numbers down, take those numbers to your doctor and ask about adjusting the dose. Your doctor is your partner, not your opponent. Mistake 3. Thinking harder is better. Straining. Forcing the breath. Holding longer than feels comfortable. Gasping. None of that helps. The technique should feel peaceful, not like exercise. If you feel strained, shorten the counts. Gentle always beats intense. Here is what I want you to remember. Think back to that moment I described at the beginning. 6:47 in the morning. Sitting at the edge of the bed, chest tight, cuff on the nightstand. 148/92. That moment does not have to be your morning for the rest of your life. It does not have to be the quiet emergency that plays out in millions of bedrooms every single day. Because the nerve that controls your blood pressure is sitting inside you right now, waiting. And the only thing it has ever been asking for is a slower breath. Your breath is the switch. Nobody was ever going to hand it to you in a 12-minute appointment, but you have it now. If this video helped you, there is one thing I want you to do. Send it to someone you love whose blood pressure has been a quiet worry for years. A spouse, a sibling, a parent, a friend. A single share from you can start a conversation that genuinely changes the rest of their life. Take care of yourself. I'll see you in the next one.